Hello everyone, good afternoon. I'm Dr. Oparaji Chimdito, a pediatrician at the Federal Teaching Hospital, Owerri. So I want to give a little information on the recent diphtheria outbreak, especially in Imo State. So recently we've had some cases of diphtheria and there has been some reported deaths, but this is not to raise an alarm, this is not to cause you to run helter-skelter, this is just to tell you the basic things you need to do. So what is diphtheria? Diphtheria is a disease caused by a bacterium called Corynebacterium diphtheria, and is highly infectious, highly contagious, but vaccine preventable. So how does it spread? It spreads mainly through respiratory droplets. So if I have diphtheria and I cough, I let out some droplets. People around me, they can inhale it. It can also spread through contact with an infected person, skin to skin, or contact with infected clothing or objects, but most commonly through respiratory droplets. So how is it prevented? One basic form of its prevention is by vaccination. The diphtheria vaccine is a component of the pentavalent vaccine, which is given to children babies at 6 weeks, 10 weeks, and 14 weeks. So this is time you parents go check your children's immunization cards and be sure your child was fully immunized. If you see that possibly they have one or two missing vaccinations, please come to the health facility. Let's go through. If you're not very sure too of your child's immunization cards, please come to the health facility and let's go through the immunization cards and look at it and know what the child is missing. Now for this outbreak, for this outbreak now, this recent outbreak, children less than 3 years, no problem. They don't need to get any vaccine because the immunity from once they took, if they are fully immunized, the 6 weeks, 10 weeks, and 14 weeks, they don't need to get anything. For children 3 to 5 years, they can get an extra shot of the pentavalent vaccine, and for children above 5 years, they get is a diphtheria vaccine in a component diphtheria tetanus vaccine, which they're giving as booster doses, and I got my booster dose this morning. So another way, apart from the vaccines, another way to prevent is this whole avoiding overcrowding. So dear school owners, this is not a time to jam pack so many students inside one class with no cross ventilation. And if a child has symptoms, okay, I need to talk about this, has the symptoms. What are the symptoms you look out for? Fever. Very important. The child complains about the pain or difficulty in swallowing, has cough, has catarrh, has red eyes. Please get that child to see a doctor. Or you look into the child's mouth and you see what looks like a whitish stuff in the throat. Please, that is not a child you take to a chemist. That's not a child you take to a pharmacist. That's a child that should get to a hospital where the child can be managed. So another way of preventing it is hand washing. I thought about avoid overcrowding, and then for health workers, understand use of face masks, because we come in contact with these sick children. It's not a time to start wearing children face masks. That's we've not gotten to that yet because we don't want the children to get asphyxiated due to lack of oxygen. But helping them wash their hands, avoiding overcrowding, and vaccinating them, are basic ways we can prevent the spread of this diphtheria. So where can you get the vaccines? You can get them at any health center, any local government headquarter, like maybe municipal, any general or government hospital. It is free of charge. You understand? It is given free of charge. And yes, diphtheria is highly contagious, highly infectious, but it's vaccine preventable. So take home now is get home, check your child's immunization records, and be sure they were fully immunized. And if they are above 3 years, get them to a health facility to give them the appropriate pentavalent vaccine. If they are above 5 years, they can also receive the booster doses. Just protect yourself. This is not a time to run helter-skelter. This is not a time to get yourself tensed up. It's just a time to just protect yourself. Thank you very much.